Hi, I'm Dr. B, Psychiatric Nurse Practitioner. Today I'm going to talk to you about when to seek professional help. When to seek professional help. We have a channel, we talk a lot about different things like depression, anxiety, your mood, how to be happy, but there are specific times in your life that you need to seek professional help. That's with a psychiatrist, counselor, a psychologist, someone that can kind of assess the bigger picture of what's going on. So I have three main criteria for seeking professional help. The first one is urgent needs, and we'll talk about those. The second is actually meeting criteria for things like depression, anxiety, PTSD. And then the third is just quality of life. Sometimes there's a lot going on in your life and you are having a difficult time handling it. Maybe you don't need professional help, but it will improve your quality of life to get professional help. So I'm going to go through those a little more deeply. An urgent need. So when you feel like you want to hurt yourself or hurt anyone else, that's the main criteria for there. That is an urgent need. Sometimes it's an emergency. If you feel like hurting yourself, specifically killing yourself, you need to go to the emergency room. Do not hesitate. Those thoughts likely will not go away by themselves, and likely you will just ruminate and they will get worse if you're trying to handle them yourself. So suicidal thoughts, we talk, unfortunately in our culture there has been an increase in suicide. We talk about the suicide in the military. This is a way, it's like your brain is giving up. Like life is just too hard. You can't come up with those personal visions. You can't do that next thing. And so it's just, I might as well give up. It's like hopelessness. And there's always hope. And I just want to tell you that we believe in you and that you can get better from this. This is not the end, but please seek professional help if you want to kill yourself. And this includes passive thoughts, like, I wish I was dead, or I wish I would get into a car accident and just die, or actually doing risky behavior, hoping that you'll die, or not caring if you die. Those are what we call passive thoughts of suicide. Another urgent time to seek professional help is if you're hurting yourself in any way. So this, for some people, is cutting. Some people burn themselves, but they do some sort of physical pain to themselves. And sometimes that seems like that it wouldn't be suicidal, and sometimes they're not suicidal. It's actually what we call a maladaptive coping. It's a coping mechanism that, for the person, it's actually working. It's decreasing the anxiety or relieving some of the pain, the emotional pain, by giving themselves physical pain. But we can help you with that, and again, seeking professional help for that. The other is kind of in the realm of psychosis. If you are hearing things, seeing things, if you are delusional, it's very hard to know when you're delusional because this is by definition a false belief. But if anyone has continued to tell you that maybe you're delusional, or that you're paranoid, or that you kind of over the top and that what you're saying doesn't seem like it's in reality, those are reasons to seek professional help, right? So that's that first criteria of urgent. You can't really wait. You need to seek that help now. Unfortunately, for many people, if you call a psychiatry office or a counseling office, they will tell you that it's a 3 to 6 month wait for an appointment. If you meet the criteria in that first category of urgent need, do not wait for that appointment. Go to your local emergency room. Most major cities have like a crisis center that you can go to that's 24 hours, and you can actually talk to someone and get a mental health assessment done. So super important for that first category there. Then the second is kind of clinical issues. This is what I do for a living, right? People come to me because they feel depressed, they feel anxious, they think they have PTSD. Let's talk about depression. Depression, we all have experienced depressed mood. We all feel depressed sometimes. But there's actually a criteria that if you meet this criteria, you should seek professional help. And we have this thing called the DSM-5, and it's somewhat subjective and is all symptom-based. So we unfortunately don't have an objective way to diagnose these things. But if you are experiencing depressed mood most of the time, or if you have pretty significant distress, you're not going to work, you don't feel like getting up and showering, you maybe aren't cooking dinner for your family ever because you just don't have the desire or care about yourself to do those things, that is an indication that we could be dealing with more of a clinical depression that does need to seek professional help, okay? The next is anxiety. Again, another emotion that we all feel. And anxiety can be in a scale. I like to talk about the scale of anxiety because we all experience anxiety. And if you think of a number scale between 0 and 10, 10 being debilitating, severe anxiety, cannot function, and 1 to 4 being kind of that mild anxiety that actually gets you to perform better, right? If you have mild anxiety before a test, you prepare for the test, you study, you get a good night's sleep, you do the right things in order to do well on the test. That's mild anxiety. Moderate anxiety begins to affect how you function. So if you begin to have moderate anxiety, you stay up all night studying, but you don't remember anything that you studied, right? This is affecting your function. We need to learn how to bring that down to mild anxiety. So moderate anxiety is kind of, into that quality of life thing of whether you want to seek professional help for that. But when you get into severe anxiety, and I like to rate that 7 and above, it's affecting your function, and it can actually begin to affect you physically. So I do recommend seeking treatment for that. Unfortunately, the first-line treatment for anxiety for many years was a medication that is in the benzodiazepine class. And those medications, we now know after long-term studies that they actually cause dementia, and they are suppressing the central nervous system, and they're only putting a Band-Aid on the anxiety. They're not actually helping the anxiety. So I encourage my patients and anyone to get off the benzodiazepines and learn to control that anxiety. And I have other videos that talk about how to control that anxiety and use it as a strength. So severe anxiety can come up as restlessness, even fatigue, difficulty concentrating, irritability, muscle tension, and it will come out physically if we don't get it under control or get it into that mild state. So again, for anxiety, it's a normal feeling. We need to be able to move it to that 1 to 4. That moderate anxiety, it's kind of a quality of life issue of whether you want to seek treatment for that. But any kind of severe anxiety, I encourage you to seek professional help. The next thing I want to talk about is bipolar disorder, which used to be called manic depression. And again, it's almost being overused again. So it used to be not commonly diagnosed. We would definitely wait till someone was in adulthood. I have assessed people who have been told that they're bipolar by their family because they have these, pretty severe mood swings. So that's not what this is. Bipolar is a very specific type of disorder that absolutely, so I'm not even going to give you the criteria here, absolutely needs to be assessed by a professional. So if you think that you have bipolar disorder, you need to seek professional help just for that diagnosis. Don't use that as an adjective. We do not all experience bipolar. We all experience maybe mood swings, but bipolar is a very serious, often lifetime disorder. And so it definitely needs to be assessed and diagnosed by a professional. The next is post-traumatic stress disorder. And we talk a lot about this. I'm a commander, a psychiatric nurse practitioner commander in the Navy Reserves. We have a lot of PTSD in the Navy, but even in my private practice, we have tons of people, a lot of sexual abuse survivors. We talk a lot now about sex trafficking and people coming out of sex trafficking. There's just a lot of reasons we could be experiencing PTSD. Very important to truly believe that PTSD is a treatable condition, disorder, whatever you want to call it, right? It can be time limited. Now, depending on the complexity of the trauma, it could be a long time to work through those things, but it is super important to seek professional help. If you have trauma and you feel like, I don't really meet the criteria, it's not truly affecting my life, I don't think I need professional help, I challenge you to use choice mapping, which I talk about in some of my other videos, to be able to map how that trauma affects you now. So not everybody with PTSD must seek professional help. If it's causing any of those debilitating type symptoms, if it's affecting your function and quality of life, you may choose to seek treatment. But you can kind of get a hold of that yourself using the choice mapping. So one of the things that we do, we have a whole section on trauma, and trauma is a lot like grief. We must grieve that this experience has changed our life, right? So grief is typically a loss. We think of death when we think of grief. The same thing that you have to do in grief, you need to do in trauma, because you have to grieve that your life has changed. You are, let's just say you were abused sexually as a child. You would be probably a very, very different person, mentally and emotionally, if you were not abused sexually as a child. I mean, there's just no doubt, right? So grieving, who you might have been able to be, who, how that still affects your life and how it affects your relationships, mentally and emotionally and intimately, how those things are affecting your relationship. So it is important to work through those and grieve that, but it's, you may be able to do that on your own. And then the last is, again, the psychotic type disorders, when you're not in reality, right? So we have, schizophrenia is the most well-known. It is a very debilitating, often they cannot function in the world. They do need to be on medication. In severe cases, they're hearing things and seeing things all the time. Some of the research on even the homeless population in our culture is that 80% of people that are homeless have a mental illness, probably in this psychosis realm. So, again, in our country, we can refuse treatment, but part of this psychosis is they have lack of insight and poor judgment is actually a symptom of schizophrenia. So having them make the right choice is very difficult. So if you have someone in your family who you believe is experiencing these things, I encourage you to help them get help. And it's super important in doing that. So if we talk about those three sections, right? Number one is urgent. You must go and seek help if you want to hurt yourself or someone else. The two is when you meet, a criteria for depression, anxiety, bipolar, PTSD, psychosis. When those things are impairing function, you go and seek professional help. But even if they are impeding, which is the last thing, your quality of life, don't be embarrassed to go seek help. Even if it's just a counselor doesn't always mean medication. But again, I'm a psychiatric nurse practitioner, so I do prescribe medication. I do believe that you can, with therapy and even alternative ways, can treat these things. But I also know that the medication often works faster and sometimes more efficiently. So do not be embarrassed to seek help, to take an antidepressant to get through what you're going through. So that's really, that quality of life piece, that last piece of, it's important to be able to be happy. So when I talk about medication, I say it takes the edge off, at least 50%. Let's say you're dealing with depression and you're having trouble being happy, choosing to be happy, engaging in life. You take an antidepressant, it should make it about 50% easier to think positive and to choose to be happy. There's no such thing as a happy pill, right? But it increases neurotransmission. This is what antidepressants do. And increased neurotransmission also just allows you to make those better choices and allows you to be happy. Someone will say, well, so does exercise. That's true. But when you're depressed, it's really hard to get up and go exercise, right? So, again, quality of life, it's okay to say, you know what, I'm going to take an antidepressant until I can, feel better about myself and get through this, specific time in my life, or for a long period of time. So again, quality of life is important. So urgent, go to the emergency room if you feel like you want to hurt yourself or someone else. And do not be embarrassed to seek help for, clinical manifestations of things or just quality of life. Okay? So as you think about those things, again, just be encouraged and inspired that it's okay to seek help and know that you are mentally strong.